Hello, I'm John Kanellopoulos, eye surgeon based in Athens, Greece, medical director of the Laser Vision Institute in Athens, and clinical professor of ophthalmology with the NYU Medical School in New York City. As a cornea surgeon, I've worked with cornea imaging over the last 20 years. We have used a multitude of technologies, both placido-based, Seinflug's scanning slit lamp, and latest OCT. And not only that, over the last 10 years, we've utilized many of these technologies in order to effectively accomplish topography-guided treatments. Any cases from simple decentered ablations to the extreme cases of significant keratoconus and significant corneal irregularities. All this prelude to bring the focus on the accuracy of measurement with topography devices in the central cornea and the paracentral cornea. We've had relative success with using Seinflug driven topography and topography-guided treatments, as well as placido disc driven topography and topography-guided treatments. But we are aware of the limitations that both of these technologies can have. The unique feature of the Cassini, having a multitude of spots and being able to, as proven in our clinical studies, be even more accurate in the center than the technologies I mentioned, has already, in this very early time, made it an intricate part of our cornea assessment. Well, we see the topography use in many different significant applications. First, imaging very irregular corneas, such as keratoconus, or some extreme post-surgical corneas, either after laser or transplant. Another group that's often ignored, I may say, is the preoperative evaluation for cataract surgery. As a cataract surgeon, I'm often facing a multitude of different keratometry measurements, some from the lens-star, some from the IOL master, some from topography, and some from refraction. And I see the Cassini being able to image these corneas, in my opinion, more accurately in the center, being a benchmark for these calculations as well. I think that the interest for accurate cornea imaging and central topography is not limited to our practice and my personal clinical and research interests. We recently had in Athens on September 14th a workshop on collagen cross-linking, high-end imaging techniques for cataract and refractive surgery. I was pleased to see that probably the element in our practice that attracted the most interest was the Cassini, the ability to have such a novel way of imaging the cornea. We have evaluated the Cassini over the last 6 months in a multitude of patients, routine, normal patients seen in our practice, and been able to compare the Cassini imaging with standard Seinflug and placido disc, as well as followed pre and post-operative many cases that we've done topography guided, cases treated with the Athens protocol, topo-guided partial PRK and high-fluence collagen cross-linking, as well as being able to follow some collagen cross-linking refractive cases that we're performing over the last few months. So we've had so far at least 300-400 cases with a multitude number of exams on each. Some include preoperative and postoperative. We found extremely high level of efficiency, specificity, and sensitivity comparable to the devices that I mentioned, placido and Seinflug. And in my opinion, in cases that involve central corneal irregularities that may be also combined with a cornea that's not perfectly clear, we feel that the data we have from Cassini may be more reliable. The Cassini Founder Circle is a quite interesting group. It comprises of several colleagues like myself, internationally placed and very active both clinically and academically in cornea and refractive surgery work. I was very pleased and honored to be invited by iOptics to be part of this group, which I found extremely stimulating because not only are we able to pool clinical data and clinical observations, but I think it excels into a think tank and to a body that can work new dimensions on how this fascinating technology can be applied in the future. I think that Cassini has already proven, even at this early stage, as an integral part of our cornea assessment. We like to have several different methods of evaluating the cornea, Placido, Seinflug, and I think it is already proven with its very high clinical validation and its ability to be able to possibly give us better data in the center and corneas that are slightly opaque to be a necessary tool in our everyday practice. So I would strongly recommend it to people who do high-end cornea work, refractive surgery, or even in people who would like to further validate keratometries in their preoperative cataract surgery.